Hi, my name's Tim, aka NOWSKI, here on YouTube, and today I'm here to talk with you all about the whole idea of guys working in the nursing profession. Let's talk about dudes being nurses. So in case you don't know me, I am a student nurse right now. I am in my second semester of nursing school. Nursing school lasts for 2 years generally. And 2 semesters per year. I'm in the second semester of my first year. And I want to make this video because I know that there are guys out there trying to decide if they want to pursue a career in nursing. So yeah, I was in that boat not too long ago, and when I was trying to decide if I want to pursue nursing, I actually went on YouTube and I looked up things like, what is nursing school like? Nurses, male nurses. What's it like being a guy in nursing school? Guys in nursing. Should I do it? So yeah, this is a video where I'm just going to give my 2 cents about the whole idea of guys being in the nursing field, and here we go. First of all, I think it's kind of silly when people use the term male nurse. It used to be kind of taboo to see guys in nursing, but it's not anymore. And when I hear people be like, oh yeah, he's a male nurse, I think that's kind of weird. I don't go around saying, oh yeah, she's a female nurse. He or she's a transgender nurse. You don't have to say the gender. He's a nurse, she's a nurse. They're nurses. Obviously, he's a male. Yes, historically, the nursing career was an all-female profession. You didn't see guys being nurses, and on the flip side, you did not see females being doctors. I think a lot of that had to do with the education barrier. Females didn't have the opportunity to the education like the males did. So the guys were becoming doctors, the females were becoming nurses. The nursing position back in the day was, from what I could tell, a doctor's aide. Fast forward to today, and we see that the nursing profession requires a lot of education. It's a very technical field. You gotta know your communication, you gotta know technology, you gotta know meds, you gotta know procedures, and you have to go through a good bit of schooling, as you know if you've researched nursing or if you're in nursing. We no longer see those gender barriers set up. Guys can be nurses, girls can be doctors, and there's no problem there. I live here in America. In other countries, you might still see that gender division. Here you don't see nurses wearing skirts and little nurse hats anymore. It's very gender neutral. You wear scrubs. At the hospitals that I go to as a nursing student, you see the registered nurses wearing blue scrubs. I read an article talking about nursing statistics today, saying that it was between 8 to 10% of the nursing professionals were male, the rest were female. But those statistics are changing year by year. More and more guys are deciding to join in and become nurses. And as a nursing student, I just want to let you know it's not weird. The only weird area of nursing where I've found being a guy nurse is kind of weird is in the OB department. I'm currently doing that clinical right now. And if you don't know what that is and you're new to nursing, that is the labor and delivery, the newborn unit of the hospital. So sometimes you do see females when it involves, looking down there. They are a little more shy and not open to the idea of a male nurse taking care of them. In general, the nurses on the labor and delivery floor are females. That's just how it works out. But whatever, as a nursing student, you do have to go through that clinical rotation. You have to go through the labor and delivery unit and, see things and do things on that floor if the patient allows you to be a part of it, which in general they do. Again, with that older population, you will walk into the room as a guy nurse, or in my case, a guy student nurse. We're wearing scrubs and things, so we look like nurses, but our badges say student nurse and it has our school logo on our scrubs. But I've walked into the rooms of patients and they do say, oh, you must be my doctor, and they start asking me questions that they want to ask their doctor, and you have to say, no, I'm actually your nurse for the day, a student nurse helping out the other nurses on the floor. And it's kind of funny for a minute, but then you get to educate them that, hey, some nurses are guys. I feel that there is plenty of room in the nursing profession for guys to be there. I see no reason why the position of caring for people, making sure they heal and they get better and they're able to go back and live normal lives, I don't see why that should be limited to only a female population. I've actually talked with nurses on the floors at the hospital, and they are very welcoming to guy nurses joining the team. I think they like the diversity. Some of them have said, and this is just from what I've heard, that when it's all females, there could be a lot of female drama on the floor between nurses. And again, this is just from what nurses have told me. I'm not trying to say what things are like just from me. This is what I've heard. They like when guys come in because guys have a different perspective on things. Sometimes guys can be less dramatic about stuff and not get caught up in the female drama between some of the nurses. That's not to say that there aren't dramatic guys out there, because trust me, there are. But overall, the nurses have told me that they do like guys joining in. And sometimes for certain procedures where there, might be some heavy lifting, some patients are pretty big, and you might have to roll them over, you might have to slide them onto another bed. So having guys there for certain procedures can be beneficial. Not to say that there aren't some really strong ladies out there. Personally, I am leaning towards wanting to become an ER nurse. I think it's a place where you can see a lot of action, it's really busy, you get to deal with some interesting people. And just in general, that's something that I'm going for. One main thing that I liked about nursing, and again, this is just my perspective as a guy, I was looking for a career that was challenging, that offered a lot of opportunity for advancement, where I could take leadership roles. And I think in general, a lot of guys look for that in the career that they're searching for. One where you can actually make good money as well. Nursing was a great choice. There are higher degrees that you can pursue as well if you ever want to. And there's a lot of exciting stuff that you get to experience. So I think that a nursing profession is totally a great choice for the dudes. Alright, so far I hope I have convinced you that becoming a nurse is a great idea. Now some guys do say, hey, I want to become a nurse because there's a lot of hot chicks that I get to work with. Yes, you will be working with a lot of females. I don't think they appreciate it if you're just there to hit on them though, so don't do it for those reasons. And I'm not even going into the whole stereotype that all male nurses are gay. Some nurses are gay, some nurses are straight, and that does not matter, so that's all I'm going to say about that. Alright, so yeah, that's all I could really think to say about this whole topic. Again, I'm just a nursing student, and this is my 2 cents of the whole idea of guys being nurses. Guys, you should do it if you're looking for a great career where you have a lot of opportunity, where you get to take care of people. A lot of people want a job where they can, help people. This is a perfect career for that. Everyone always came up to me and they're like, oh, you're a nurse. Why didn't you want to become a doctor? Now that really pisses me off because, one, I didn't want to pursue more schooling. This is a second career for me. And I don't want to spend that much more time in school, so no, I don't want to go to med school. 2, I don't want to be a doctor. It's a totally different career. The doctors are there to make the medical decisions, make the diagnoses, give the orders. The nurses are there to carry out the actual care of the patient. And 3, it wasn't about the money. Yeah, doctors make a shit ton more money, but I don't really care that much. I think nurses make great money. You could advance and make higher salaries, and it is plenty enough for me. So if everyone pulls that question on you, why didn't you go to med school to become a doctor? Just tell them to shut up. Alright, I hope this was a little informative to you and that you enjoyed it. I do post other videos here on YouTube about nursing school. My first video that I posted about nursing school was about my first semester in nursing school, what it's like starting nursing school, the different degree options that are out there, the associate's degree, the bachelor's degree. So go ahead and check that out if you want to. Then I posted a second nursing school video. It's just an update of the point I'm at right now in nursing school. So feel free to check that out if you want. And there will be future nursing school videos, videos that relate to nursing. So you should subscribe to me if you want to, which you do. You just subscribe to me, okay? I also vlog about all sorts of other stuff like music, movies, things that I think are cool. Feel free to check those out, and I will talk to you all again soon. Bye.